It's easy to show up at medical school with a backpack full of plans. We want to do and learn the things that make patients happy, and we want to be happy ourselves. But we immediately hit a wave of options, and the paradox of choice takes over. Which path do we choose, and will we be happy with whatever we choose? It's sometimes paralyzing, the opposite of the confidence we tried to show during med school interviews. When all we know is that we want to grow as people and as professionals, how do we even begin to move forward in a way that makes sense?
Gangnam Style.
What is it about your life that made you want to become a physician researcher?
I grew up in a house that was attached to a barber shop. Then I went to medical school with a plan that I would take the barber shop, because Dad was getting older, take out the barber chairs, put some paneling in. This is Johnstown, Pennsylvania, and then I would have 2 exam rooms, and it would be perfect. And the place where the 3rd chair was, that was going to be my office. So then I went to the chief of hematology at Hopkins, who had been there forever, since 1939, and he said, you should do the new thing. It's called an MD PhD program. Now this was blowing my plan completely. It's like, how am I going to do that in a barber shop, right? I said, well, what would it take? He said, well, you got to spend 7 years instead of 4. Ooh, right? But you get to do research, which to me was like playing. I mean, really, it's a sandbox, a laboratory, same thing.
My kindergarten teacher report said, well, you know, I think she's smart, but she really likes to be with people. She loves being with people. And my 2nd grade teacher said she always gets her work done, and then she just loves coming up with new projects and new things for us to do in class. So I think being a very focused overachiever has been a very consistent part of what I was like when I was young, loving what I do, loving people, and loving thinking of new ways to make things better.
My career took a global health turn when I was a pediatrics resident at Columbia, and I was in an immigrant community. But I spoke some Spanish, so I ended up with an almost all Spanish-speaking clientele in my pediatrics, and diagnosed some parasitic diseases, learned about the health challenges of immigrants, started to get very interested in the health challenges of folks back in the home country, and ended up getting training in parasitology, infectious disease epidemiology, and launched my career in global health.
Research isn't easy. It's a lot of risk. There's a lot of unknown. Why do it?
So you can make disproportionately great contributions in research. That's probably the payoff of the systematic and plodding and incremental nature of research. It can get frustrating because you're making achievements in little pieces most of the time. You don't have these breakthroughs all the time. But I think the fact that you can make these kinds of contributions lures many of us into research.
For you personally, what was important about being a researcher as well as a physician?
Yeah, you know, I could never have imagined when I was a first-year medical student, I never thought I'd be interested in research. I thought I wanted to be Marcus Welby. I wanted to be the girl version of Marcus Welby. I wanted to make house visits, and I wanted to know families, and I wanted to make a difference. And I wanted to be part of the families in how we can improve health together, because we can't work in isolation as physicians. We need to work in partnership. I didn't actually know this was research at the time, but I was a medical student, and I was in this group where we would go out into schools, elementary schools, middle schools, and high schools, and we would teach students about making a personal no-smoking decision. So we would go and we would teach. We had great knowledge. I could tell you why smoking is bad, But I noticed nobody was listening. It made me realize that knowledge is necessary, but it's not sufficient if you want to change behavior and improve health. What we did was we changed how we interacted with the community. So now we started off with a music video. It was followed by a very brief, why should you care about this? How is this relevant to you and your health? And then they had to actually touch lungs. I worked with my pathology department. So I brought a normal lung along with emphysema, along with cancer, so you could actually touch it. And then they filled out a survey. And it was a before and after survey. What do you know about this? Why should you care about this? How could that affect your health? And I didn't realize what I was doing was research. I was asking a research question.
What contribution do you see your story here making?
If I were a radiologist, it would be odd for me to hand you back the MRI and have the radiologic technologist perform the imaging study. But I don't look at it. I hand it back to you, primary care doctor, and say, if you have any questions about figuring this out on your own, give me a call. Seems crazy, right? I mean, a radiologist ought to read it. But what do we do in the clinical lab? Well, the lab test menu got big, right? So you have a clot. Now I'm going to give you the results for factor V Leiden, prothrombin 20210, protein C, protein S, antithrombin, 2 lupus anticoagulant assays, and I'm saying, you got that, right? Just as ridiculous. So what we did was to create an interpretive service, which we started at the Mass General in 1995. Here it's taken on the name Diagnostic Management Team. And we do it for coagulation and now a number of other areas. We provide a narrative report that this 26-year-old woman developed a stroke. She was on oral contraceptive. She has a factor V Leiden. And we explain the whole thing. So we're not just tossing back a bunch of numbers.
The international work, I got a real sense when I was working as a young pediatrician that the magnitude of the health problems were so vast for children and their parents in developing countries that I could probably make more of a difference. I'll quote a colleague of mine. I got an OBGYN friend of mine involved with our work in Zambia. And 2 or 3 years into the work, which went very well, and he made massive contributions to that, it was a tremendous partnership. He came up to me and said, look, I've been delivering high-risk babies my whole career, and I calculated that I've saved more lives in the public health work that we've done here in Zambia in 6 months than I possibly could have saved in my whole career in the United States. I felt that if I didn't do clinical medicine, clinical pediatrics in the United States, somebody else was likely to replace me and do as good or better job. The nature of the work that I could do internationally, I might be doing work that nobody else would do. It simply wouldn't be done if I didn't do it. So I had this sense of mission, if you will.
What advice do you have for students like us who aren't sure if they want to do research?
The sooner that you can connect with potential mentors, people that can show you what it's like when you apply it in your life, so that you can be learning the knowledge and know if the content interests you. But then you can marry that with what does that actually look like? How is that applied to a real person or a real community? Or how you take an idea and bring it to fruition when you're a researcher. I think you need to be introduced to that in a really hands-on way as early as possible.
There's such a wide swath of options for research. I mean, you can go from the most basic science to sort of translational science to clinical science to a different kind of translational science to public health science, that there's so many options. And if you can find what fascinates you, what drives you intellectually and is worthwhile, you may be a researcher. And if you're utterly fascinated by sort of, laparoscopic, robotic urology, and you just are amazed at what you can do clinically, and the pleasure you get is in that clinical service, own it. You don't have to be a researcher. You can be an outstanding clinician. When I'm sick, I go to an outstanding clinician. When my kids are sick, when my wife is sick.
How do we find what research questions we're driven to answer?
Well, it depends how much you're willing to tolerate. So if you're willing to tolerate the patience required to sort out the basic elements for a Nature paper, you're going to require an immense amount of patience. So you got to understand this could be years and years and years and years and a whole bunch of luck too that might be associated with making that big discovery. If your patience is a little less, but you're still interested in the process of discovery, you can pick other projects that are extremely important. You could try medicine A versus medicine B, see which one works. You will get an answer. It will change practice. So I think a lot of this is matching a personality to the type of project that you would do. A lot of people say, climb the mountain, go up higher, do more and do more. I think the key thing is you got to know which mountain you're climbing. And you have to be really careful to know that that's what I really like to do. When I get to the top of that mountain, I'm going to be blending in all the things that I most like to do and all the things that I'm kind of scared of. Maybe they're not my strengths. That's on a different mountain.
It's clear your research is improving the way we do a lot of things. What do you hope your years and years of hard work do for us?
This now becomes fundamental to us. If we're doing well, we want to do better. If we're doing better, we want to do outstandingly well. If we want to do outstandingly, we want to do superior. I mean, there's no level at which we can't improve our processes. So the old attitudes where a Herr Professor says this is the way we do things, that's not how we look at life anymore. And I think I'm proud of the small role that I've played in that changing attitude.
I would love to say that somewhere along the way, a diagnosis was made more quickly and more accurately because there was an innovation at some point in the history of laboratory medicine where they said you can't take a bunch of pieces of diagnostic data and hand them to a primary care doctor who has 15 minutes to see a patient and let him or her figure it out and make too many mistakes. But that changed, that inflection point happened because we were thinking about how to do it better.
I do have a sense of legacy. You know, the older you are, the more you think, well, I'm going to be retired in 10 or 15 years or 20 at the most. And I'd like to leave people who have my skill set and better and my insights and more, and the work continues, if you will.
My options in front of me can feel pretty overwhelming. There are a lot of voices telling me what to do. What should I care about most?
Being smart is not enough. You have to be smart and compassionate. You have to be smart, compassionate, and an advocate for your patient. And you have to do everything that's possible to not only make a good diagnosis, but really to take good care of your patients.
My grandfather was in a sulfur mine in Sicily when he was 4, holding the parakeet who would die before the explosion occurred and all the miners could run out. And I visited that site in Sicily. My father's life was much better, he said, because at that same age, he was in a barbershop shining shoes and cleaning the spittoons, men spit in the 1920s and 30s, into a can while they were waiting for their haircuts. And that was way better than being in a sulfur mine. So then I had this opportunity to do what I did. And my kids have said, what do we do? Where is that next step? And I said, the next step is having the flexibility to do precisely what you want. Precisely what you want. If there's a period of 4 years where you don't earn any money because you're on a trail to, as Joe's interested in politics and Maria's interested in economics, where you just have to work and you're not going to earn enough money, I hope we can get through that phase and you can get to the point of making the exact contribution that you want to make. And to know that early and to like as many minutes of it as you can. So that's really what that is about, and I think that's really the pinnacle. Whatever you like to do, it's just that you're not forced into any survival mode to be able to do it.
But I think what's important is that you pick a place and you start walking with certainty and you keep your head up and look around for opportunities along the way. And it's that leads you then to your path and what has led me to be a physician scientist.